Good evening, everybody. This is our Tuesday training. I haven't come up with a special name yet for Tuesday training. Something that's terrific Tuesday training. Uh, well, no, I haven't come up with a real catchy name for Tuesday's trainings, but there seems to be a good time for most people. And then, of course, we have the recording. So many of you probably already know the difference between original Medicare and a Medicare Advantage plan. But I thought for anyone who is new to the industry or is returning to the industry, I would just break it down very simply because when you're talking with someone and you're going over what their Medicare options are, when you boil it all down to have a comprehensive program, there are only two choices. Now, there could be a lot of other sub choices, but there really are only the two choices. The first one is to use original Medicare, the red, white, and blue card. And with that, you know what? I'm going to ask everyone if you would mute because I hear myself and I don't know why. Okay, now I don't. So with original Medicare, the red, white, and blue card, of course, that's Part A and Part B. Part A is going to have your hospital, your skilled nursing, blood, home health care, a couple other things in Part A. And if you notice in the Medicare and You handbook, Medicare says that Medicare helps you with the expenses of Part A. It also says that Medicare helps with the expenses of Part B, which are all of your outpatient expenses. Those would be your doctor's office visits, no matter what type doctor, your lab services, your Part B drugs, your therapies, your lab work, x-rays, all of those things come under Part B. Now, when the original Medicare says to the Medicare beneficiary, it helps with those things, it means that Part A of Medicare and Part B does not pay 100% of their expenses. Many people feel like, and they are misled to believe, and this is one of the reasons why people get so confused. They're misled to believe that when they become 65 and they get Medicare, they're going to have full health insurance program and they don't have to worry about anything. Well, they're going to get that Medicare Part A and that Medicare Part B from original Medicare. They'll get original Part A if they have worked for 40 quarters and paid into the Medicare system. So the taxes that come out when they were working for 40 quarters, they get the Part A and they have no premium. The Part B they get when they become 65, or if they are disabled on the 25th month after receiving 24 months of Social Security disability payments. They get A and B. So they get the B, but B has a premium. And that premium is set by Medicare. It's not set by the insurance carriers. It's not set by us. It's not set by Congress. It's set by Medicare. Medicare being a part of the Social Security Administration, which is under Health and Human Services of the United States government. So it's a federal program. So someone has Part A and Part B, and now they're going to have some balances left over because Medicare is only going to help to pay them for those expenses. So one of the ways that we can help the individual who chooses to use Original Medicare as their health insurance is to offer them what's called a Medicare supplement or a Medigap. And this is where you say to them, now, those pieces that Medicare approves but doesn't pay, most of those can be covered by a Medicare supplement plan. And the Medicare supplement plans have letters that go all the way to NKJL, a whole lot of letters. And each plan is different. But every Medicare Advantage, Medicare supplement plan or Medicare Medigap plan, no matter where it is identical. It's issued by private insurance companies, so there is a premium. So now on top of the Part B premium, if they want to purchase a supplement and they're new to Medicare, they're just turning 65 or just getting Medicare, the premium could be anywhere from $130 a month to $230 a month, depending on the area, depending on if they're a tobacco smoker, depending on if they are the gender of the person, and depending on the carrier. So carriers offer the same benefit, but at different prices in different areas. So on top of the Part B premium now, they will have that premium for a Medicare supplement. Then to round out that comprehensive first choice, they need a Part D, D for David, D for dog, prescription drug plan. And that prescription drug plan can range from $18 a month to $118 a month. Again, depending on the area, depending on what the drugs they need to have covered, depending on the carrier. Yes, there's a premium for that. So now this person that you're talking to about the first choice, using that red, white, and blue card that they were so excited about getting, if they really want to have a full comprehensive plan, they're going to have 3 cards: the original Medicare card, the supplement card, and the prescription drug card. And they're going to have an out-of-pocket monthly cost exclusive of the Part B, because it doesn't matter which choice they take, they're going to pay the Part B. But with the supplement and the prescription drug, they could be paying anywhere from $150 a month to $300 a month. And this is just initially. So you don't even need to think about what they may pay 10 years from that day, because those 2 premiums are probably going to increase, and definitely that Medicare supplement premium is going to increase. But you're not offering this and you're not educating them about the Medicare supplement to discourage them from taking the Medicare supplement. You're educating them to know that it is available. And if they want it, this is their choice. And this is what it will cost them. And because we're in the United States, they have freedom of choice. They can choose the Medicare supplement. It is an option. However, they'll pay for that option. Now, what do they get on the plus side? On the plus side, any provider who accepts Original Medicare, the supplement will pick up, depending on which supplement they take, after Medicare has approved and paid their portion. Then the Medicare supplement steps in. So they don't have to worry about a network. They don't have to worry about a referral. It's if the first piece, the truck, if the truck can move, then the trailer can move behind it. And the trailer is the Medicare supplement. The trailer will not move unless the truck moves first. So that's the first choice. Now, alternatively, because you're educating this person that you're sitting with on what their choices are, and it's fair to them to let them know that's a choice, and you may not take as much time as I've just taken to tell them they're going to have 3 cards and 3 different plans, and it may cost them almost $300 a month. The second choice would be to do a Medicare Advantage plan. And then there are sub plans under the Medicare Advantage plan. It could be an HMO or a PPO. So that's where you will explain that the Medicare Advantage plan is a plan that combines the benefits of Medicare Part A, Medicare Part B, and Medicare Part D. So all 3 of those pieces are combined into one plan, one card, one carrier. And instead of original Medicare paying first, original Medicare will pay no benefits. Original Medicare will pay the insurance carrier that they choose. And that insurance carrier will get paid directly by wire transfer from Medicare every month for that person, whether the person goes to the doctor or not. The insurance company then becomes the qualified insurer for their health insurance benefits. And benefits are delivered differently. There's no requirement that original Medicare pays first because original Medicare doesn't pay the provider. There are requirements, though, within either the PPO or the HMO because they are managed care benefits. The HMO is going to be managed to a greater degree because all the benefits, unless they are emergency benefits, must be in network. Some plans will have a POS, point of service, that's added to them, so they may offer an HMO where some benefits can be outside of the network, and those will have a higher copay. So instead of the person paying the premium for the supplement and the premium for the prescription drug every month, whether they go to the doctor or not, they have no premium. So now they're saving that money, that I'll say $300. It's in their bank account every month. They're not spending it. However, when there are copays within the plan that require that they have a copay, they will pay the copay and the coinsurance that is in the actual plan that they've chosen. The other thing is with original Medicare, there is no stopgap. There is nothing that says this is the most that you can pay. With the Medicare Advantage plan, yes, there is an out-of-pocket cost for certain benefits, but every year, every plan has a maximum out-of-pocket for medical expenses. So that's the piece that can be compared to what is the cost of the prescription drug and the Medicare supplement versus what am I going to be paying if I had the worst case scenario under my Medicare Advantage plan. The maximum out of pocket in the Medicare Advantage plan is medical, covered medical. So it's not, doesn't include the prescription drugs. And as you know, within the prescription drug model for either the standalone prescription drug plan or the Medicare Advantage plan with prescription drugs, the Medicare model has those stages so that once you get through the initial stage, you're going to go into that coverage gap. Some plans will cover generics during the coverage gap, the same as they did in the initial stage. Some will not. Some will, everything will go to 25%. So it all depends on the plan. That's another reason why you always ask for the prescriptions. People sometimes don't like to take the time to research and give you all the information you need, but in order to give a good answer and suggest a plan that's going to fit best for them, you need to know who their doctors are and what prescriptions they're taking. And that includes the dosages of those prescriptions. So the two choices boil down to either using Original Medicare or using a Medicare Advantage plan. And from there, that's how you will come to talk to your customer about which is going to best suit them. In most cases nowadays, it is becoming to be a Medicare Advantage plan. But I thought that it was important that you know that the choice doesn't always have to be a Medicare Advantage plan. It could be the original Medicare with a supplement. One key point about someone who is turning 65 or having Medicare for the first time, during that time, they can have a Medicare supplement without answering any health questions. So after those first 6 months that they have Medicare, that goes away. So some carriers are more lenient with the health answers than others. So if you have someone who wants to go back to a Medicare supplement, then you may have an issue 2 or 3 years down the road. With the Medicare Advantage, if they have had a Medicare supplement and they go to a Medicare Advantage plan for the first time they've ever had a Medicare Advantage plan, then for the first 12 months, they have a special election so that they could go back to the same Medicare supplement that they had in the past. Now, it may not be at the same rate because if the insurance company had a rate increase during that time, then they're going to pay a higher amount. If they had a birthday during that time and they're a year older, it may mean that the rate is higher, but they can go back to that Medicare supplement without answering the health questions. Any questions? I have talked for an entire long time, a long time. What are the questions?
I have a question about the chronic illness, or I think that's what it's called. Is there a special plan, or how do that work with the Medicare Advantage or any of the Medicare? If you got a chronic illness or a devastating illness like cancer or something like that, or diabetes.
And in terms of what you mean, Judith, because there are some of the carriers do have chronic plans. Yes, those are your C-SNPs, chronic special need plans. Some of them do have them. And each carrier actually has their own designation of what chronic illnesses are considered for their plan.
Okay.
Some are very specific, some are broad, some have 7 different chronic conditions, some have only 3. So each company has their own chronic plan if they choose to offer a chronic plan. So that's the Medicare Advantage plan that I'm speaking of.
Mhm.
So if someone has one of those chronic illnesses, and I'm not sure, Gus, I haven't seen one for cancer.
No, it's not one for cancer. It's for those chronic conditions, um, diabetes, heart failure, that type of thing. Yeah.
So for any of those chronic plans, if someone has one of those conditions, and let's say it's in July, So now we're not in AEP, we're not in OEP, and they want to change their plan and they're diabetic. So that's a way to use the SEP to change them to a chronic plan.
Okay,
And it may not be that they're going to stay with the chronic plan, because the next year when annual enrollment comes, the basic core plans may be better than the chronic plan. The chronic plans are designed to give more attention to the specific chronic illness, but doesn't necessarily mean that it's a better plan because the person has a chronic illness.
okay,
If it's a Medicare supplement, or this is someone new to Medicare that you're talking to and they're in treatment for cancer, then if they can afford the Medicare supplement, it will work better for them.
Yes.
And
Okay.
any other questions? Lauren, you had a question?
Yes, please. What you touched on, the 12 months of that considered the SEP for trying, if they want to go from a Medicare Advantage plan back to the original plan. Um, during a training, I'm understanding they can go back prior to the 12 months, but if it's after the 12 months, they can reapply, but they have to go through, I guess, some sort of underwriting.
Yes, they have to
Is
answer
that
the
what,
health questions if they're outside of the 12-month period.
if they're outside of the 12-month period? Okay.
So at any time during annual enrollment, someone who has a Medicare Advantage plan can say, well, I think I'd rather use original Medicare, a supplement, and a Part D plan.
Mhm.
But if they are outside of that first 12 months for someone who had their Medicare Advantage plan for the first time, or if they're out of that first 6 months when they first became eligible for Medicare, then they have to answer the health questions. And that's what the underwriting is. So each carrier has their own underwriting guidelines. Some will accept a yes answer for some questions and then rate the plan up. Like the quote that you get may show $230, but because the person had a certain answer of yes, it could end up being $250 from the carrier. They will accept them with a rate up. Others will let you know if there is a yes answer in this section, it's a knockout. They're not going to take them at all.
Okay. But previously you had spoke about, I think it was last session, and I was kind of a little confused. The 5-star plans you were talking about that we can use all year round because it's a 5-star plan, or?
Yes, that's something if you have, and always find out at the beginning of the year which are the 5-star plans in your area. That's something you carry in your hip pocket the entire year. You could write somebody November 15th in a 5-star plan.
Thank
And
you.
I will add too, the way that you can determine that in your area, if you're using the Sunfire, it gives you an option there to put in a zip code, click 5-star, and if there's any 5-star plans available, it will display them for you.
Oh, okay.
And we're going to go over Sunfire a little bit too. So you may get a chance to see that.
Thank you.
So 5-star is that SEP that you can use. I mean, that it means a lot for a plan to be 5-star. But now just remember, check it every year. It doesn't mean because it's 5-star this year that it's going to be 5-star next year. It also doesn't mean because Humana Gold Plus HMO is 5-star that Humana Choice PPO is 5-star. Each plan has its own star rating. Any other questions? Everybody's so
I
smart.
got a question. Does
Yes.
Starfire, because I'm not sure, I never used it, but does it look up, can you look up the doctors and medication and everything through Starfire? Or how do you go about looking up those information to verify if that person's needs are in that plan?
You can add the doctors and the prescriptions in Sunfire. Yes, you can. I also check on the carrier site to be sure. And you should do that particularly, I'll say, during the first quarter, because remember, today's December 31, tomorrow's January 1. So when that stuff goes up to hit the internet on January 1, it may not be as accurate as you think it should be. Or it may just not be updated yet. So during the first quarter, I kind of double check myself through the carrier site as well by adding the doctors and the prescriptions. But yes, you could do those in Sunfire as well. Anything else? You want to share your screen, Gus, or you gonna go over Sunfire a little bit?
Sure. Let me share my screen here. Oops. And where is share? Okay. See my screen there?
Yep.
Okay. Well, the screen you're looking at, once you register for Sunfire with Advocate, this is an email that you will receive. And it'll have the link, and it'll tell you what your username is and how to set up your password. So once you register, when they send you this email, you would set it up. And you can use this link. It will take you to your Sunfire. Now, mine is already saved there, but if you was brand new, you would enter your email in that format that they gave you there to set up your password in the email, and it will give you access. And that's what Sunfire looked like. What I'm going to do is I'm just, let me see if I got a sample in here. There's Rafi. He won't mind if I use him. I don't think any his personal information is there. Well, no, I better not do that. First off, when you're looking at this, if you got a client's information right here, if you click here, it will allow you to add your client's information. And I would recommend you do that because it's kind of building your client database. And you just simply click on it and you can enter their name, date of birth, address, and all of that information are right there. So I would always recommend you do that if you got a client's information. Okay, it's pretty easy. And then once you get it in, of course, you can quote it. But for today, because of time, I'm just going to do a quote and enroll. See up here, it says quote and enroll. So I just want to look to see what's this information for a customer. So quote and enroll. It opens up. There we go. You can do it two ways. If you click this box here and you have that individual's Medicare number and date of birth, you can look it up and it will actually display the plan, their current plan that they're enrolled in. But if you don't have that information, Medicare number and date of birth, you just want to look it up and enter the doctors and thing, just click the zip code, and whatever zip code they're in, enter it, and it'll come up. Now, if you enter a zip code, and some zip codes will, multiple counties are shared by that same zip code, and it will display it there if it was. Okay. Let's see if I got one here.
Try 338.
75338.
No. Oh, no. 3. I was giving you a Florida one. I'm
This is-
sorry, go ahead.
Let's see if, I was thinking I had one here that would,
You can try 34758
three,
or
4,
59
7, 5, 8,
or 59, sorry.
5, 9. Yeah,
Yeah,
bingo. See, so that's why you want to enter the zip code and make sure you're selecting the right county, because you may see a plan in one county that's not available in the other. Sometimes they'll have both, but you always want to check that and verify the county that they live in. Say, hey, Mr. Jones, Mr. Wright, which county are you in? And they'll tell you. All right. So we're going to select Polk County there. And I want to look at Medicare Advantage plans. And as we go down this list, it says, are you currently enrolled in a Medicare Advantage plan? If you say yes, you can go and find that plan, load it in there. If you got the Medicare number, like I said earlier, it will actually display that plan and pre-populate it in there for you. Okay.
guys, would that happen even if you didn't write the plan?
Yes, that's correct. It doesn't
When
matter
you-
who wrote it, it's just their history. It will show the past 2 plans that they were enrolled in.
So they're pulling that from the Mars system?
Yes.
Okay,
Yeah, in some cases, it will show the LIS level as well as the Medicaid level. Not all
Okay.
cases, but they're getting that information loaded in there. That's
okay.
why it's good to use this. Okay.
So Sunfire is pulling information not just from what you have stored in there.
Right. No, yes, it's pulling from the database that CMS feeds all that information to.
Okay,
Right. So I'll answer no. Then ask your current plan. If you got original Medicare, I don't know. If I'm just doing a quote, I don't know. To your question, Judith, here's where you would enter your doctor. You have a doctor's name there in that county that I can enter?
use Jane, Jain.
That's the last name?
Yes,
See, and it will automatically pull them up. Now if you,
her first name is Manuel.
Manuel, okay, let's go there here. Now, sometimes see up here, this will default to 25 miles out. And if you're looking for a doctor, you put it in, you might not come up. Just go over and change your miles, because sometimes it's outside of that mile rating or 5 or 10 or whatever. Just change it and you can see if they're in there. Okay.
Okay.
And then once you select their doctor, let's go back here and select Manuel. It gives his address. This required disclosure. This is for you and very helpful in their plan. You may know it or you may not. But if you know a person maybe once every 3 months and say, hey, I see the doctor once every 3 months, or I see him every month. If you put that in there, it'll kind of help you give them it will give you an estimate of that potential cost for the year based on their frequency. But if you don't know it, just click unknown. Not going to hurt anything. This is where you would enter your medication. Okay. I'm going to enter lisinopril, LIS. If you start typing the drug, it generally will display them there. Okay. And you can add as many drugs as you choose, and as the dosage, the different ones. If you know what it is, you want to check it. In some cases, it will tell you the most common or most frequently prescribed medication if you don't have all those details from the customer. But you can enter all their medications. I think I'm going to enter a couple here. So let's save it.
Put one in that's not going to be covered,
Right.
if you can think of one.
Let's see. Let's think of
Would Xarelto be covered?
let's see.
Zoloft.
Zolar. It's not covered. Let's see.
I don't think it is. I don't know.
ZOLOR.
I saw it.
Yeah, Zoloft. With the
FT.
FT.
It's down. There it
Yeah.
is.
I'm gonna put that one in. As for
Okay.
thyroid medicine, I know they've taken it off. It's never covered. And I see a lot of people taking it. I was trying to think of the name of it.
Synthroid?
Um,
Okay, come on, Nurse
okay, I know
Lauren.
what it is.
Give us
LEV.
some medication for
Yeah.
thyroid.
Well, it's levothyroxine. LEV.
Oh, yeah, that's covered, isn't it?
No.
Not the capsules, I don't think.
Oh, okay.
Okay.
How do you spell it?
LEEDO.
VO, no, one V, LEVO,
LEVO.
TH. There
There
it
it
is.
is. Yeah. Okay, so you can just add the medications, but we added those. If you know they get them at a particular pharmacy, you can enter that. If not, you just put no. Do they get extra help? Yes or no? By using them, if they will get if you get their Medicare number prior to doing this lookup, you could you could actually answer that definitively, because if they are getting it, whether they know it or not, it would show it when you look up their Medicare number. But here, I don't know. And these focus questions are things that are important to the member. If dental is important, do they want flexibility, insulin savings? And this just kind of, the computer will kind of identify those plans that are known in that
Transportation.
area. Okay. Do what?
Click transportation.
Transportation. And once you get that set up, view all plans. It loaded 47 plans in that zip code or that county that's available. Okay.
Well, it costs a lot.
And do what?
The estimated annual cost is gonna be a lot. I hope most of that is drugs.
It is, and that's what you'll see when you see that cost. That's the first indicator you look at, is telling you some of those drugs are probably not on formulary. And if you click here and you look to
Only
pharmacy,
one out of the three is
one out of the
covered.
three are covered. That's why that number is inflated. All right. So now, before we move forward, over to the left here, if you was looking to see if there was a 5-star plan in that market, you could click here and see it pulled up all the 5-star plans that's available for that zip code. So like Faye said, you can have that loaded in your pocket. Well, if you know your market, you can do that in advance and you kind of know which one of the 5 stars that's available to you. The other one is the give back plans. If you want to see what's available on the give back, the Part B give back, it will tell you. So it's a good filter to help you kind of identify quickly what's available in your market area or that zip code or that county. Okay.
Does it also tell you how much they give back?
Yes, if you look at this
Part B
plan.
give back. It was right up there. Go back
There you
up.
go.
Oh, okay.
See, this one give back up to $20.
The one up top gave back like up to 165.
Yeah.
That one gives up
Up
to
to 165.
165.
Yes. It will tell you exactly what it is.
Okay.
So what I do is I filter through and I look at these plans that's available in my market, and I look at the ones that's giving the most value and know what those benefits are. So when somebody asks me, you already know. So it makes you really look smart, but I'm not that smart. I just know how to use the library. So, okay.
I noticed some of them say not appointed to sell, so are you
Well,
able to narrow
they're
it down?
all gonna say that if you're not appointed. And this
Yes.
is a Florida and he's in Texas.
Right.
Okay, no, I was gonna say, I was gonna ask if you can narrow it down if you were not appointed, even if it was in your area.
Well, if I was appointed to sell, these plans, when you hit this arrow where it says
Mhm.
not appointed to sell, it will be a button to enroll.
Okay,
It's very, very vivid. But the reason that even if you're not appointed to sell, as an agent, it gives you an opportunity to look across the market to see plans. Because when you sit down with somebody, I can emphatically tell them, hey, I reviewed the available plans to you, and it was 42 of them, which I did, right?
mhm,
But all 42 of them are not going to be appropriate for them. But it just gives you that knowledge that you did actually look at them and you know what plans are available in your market. That's why I use this, whether I'm appointed to sell the plans there and all the market or not, I look at all that are available and then I narrow down and look at the ones I'm appointed with. Because what I do is evaluate plans based on the value they deliver, and that's the ones I appoint with. And if you do the same thing, you can eliminate a lot of plans because they got 47, but some of them, they just don't deliver value. So why bother to be appointed with them, right?
And then if you're looking at it and the plan, let's say the cost is low, the estimated annual cost is low, but the primary care doctor isn't in that network.
Right, right.
You don't need to just ask to be appointed with them just because the cost appears to be low because the person's not going to take it because their doctor isn't in there.
That's correct. And you see here, but those are the main things we want to point out, the 5-star, the Part B give back, and there's one other thing. When you're quoting these plans, this is Medicare Advantage with Part D. You can look at Part D drugs only. This is not a good platform to look at med subs only on it because it does not display them all. And then the Medicare Advantage plans, those are the Medicare Advantage plans without a prescription drug plan embedded. Those are the MA only. And the special need plans is going to be here, like Judith, you were asking about the C-SNP, and this is where we show the duals and any C-SNPs that's available in that market. Okay. See. So that's
So
how
Optimum and Freedom are the only two that have
a
C-SNPs.
C-SNP, right?
And they're also 5-star,
Yep.
or at
Well,
least
let's
Optima
see.
is.
Optima
Optima.
is.
Yeah.
Right.
Well, I guess my question, as a matter of opinion, when you see all of those plans pop up in front of you and you're in front of a client, I guess being elderly, to try not to confuse them, do you try to pick the top 3?
Well,
You want to pick one.
you
That's
only got to
why
do.
Okay.
even if you're doing this with sitting with them, you're not going to show them the screen
No,
until
no.
you have gone through
And
and looked at what's there and you pick one.
right.
Okay.
And that brings up an interesting point. Now, you know, we have a 48-hour rule, right? So if you get a scope of appointment and you know you got 2 days before you can actually meet with the client, and you can have the conversation with them and say, hey, Mr. Wright, we have an appointment coming up. If you don't mind providing me your doctors that you currently see or prescriptions you are currently taking, I can kind of review those and let you know what they are covered or what's going on with them, right? You can have that conversation. I have it, and I have never failed. Clients will send me that information. So this is where I'm at the office and I'm doing my homework. So when I meet with the client, I'm making a recommendation that I filter through because I know exactly which plan that's going to be there. But if I'm in front of someone for the first time, no, I don't show them the screen at all because it will confuse.
You don't want to show them that. You would not want to do
No.
that.
It would confuse them. So just use this as a tool and think about it. If you're in the presence of that person, you know, and you can put their information in, you can very quickly drill down on the plans that you are contracted with. See, I'm not contracted with all 42 of these, and you won't be with every carrier on that platform. So if you're with a client, I would not advise you to show them the plans that you're not contracted with. All right. That would not be a good business decision for you to do that because you wouldn't be able to sell that plan to them anyway if you're showing it to them and you're not contracted to sell it. Okay.
Okay. And those questions that you're asking to do your homework prior to the appointment time, are those supposed to be recorded, or that's just
No.
that's
Yeah.
just talk?
That's just talk. Because
Okay.
if a client call me or give me permission to call, I'm calling them. Hey, Miss Harden, this is Gus. I'm calling just to discuss how we can assist you. You wanted to talk about your Medicare, right? We're just having a conversation.
It's the enrollment this year
It's the
that must be
enrollment
recorded
process.
if
Once
you're
I
not with
determine,
them.
right, once I determine I'm gonna enroll you in this plan, then I need to record that process.
Okay, thank you. Yeah, I think she said that last week. Okay,
Right,
thank you.
right.
That's what I wanted to be clear on.
Right. Yeah, this is general information, and like I say, and I have not had any issues with it. And if you're having that conversation and you're listening, people will just tell you really a lot of what you're this information. Yeah. So, but this is how you use this tool here. Okay, so now you see Dr. Manuel James. See it come up, say it in network. Well, if that doctor wasn't in network, it would say not in network. So this is the other way that you can looking at this plan, and you told me this is your doctor, and I'm looking in, not in network. I'm not going to recommend a plan that's not, that your doctor's not in network. All right.
And then you may come to the point where everything is in place. They want more dental, they
Mhm.
want a give back and all of that, but their doctor is not in network. So then you got to ask that question. Don't be afraid to ask the question. How important is this doctor for you? Or let's say we had put in all of their doctors, and so they have a cardiologist, a neurologist, a primary, and a dermatologist. So the dermatologist may not be in network.
Right.
How important is that dermatologist?
Yep.
Or the neurologist may be more important than the primary.
Correct.
So you got to, really ask the questions and
Yep.
don't be afraid to ask them, and just think of nice ways
Right.
to say things like, is this really important for you? Are you going to put your life on the line and your health on the line because you have to go see Dr. Gus?
Yeah. And the other point on that too is most of the people, when they want to talk to you about their Medicare, there's a reason for it, and that's why that needs, right? You did that on the front end. You determine why are they considering changing? And if cost is the factor, they're looking, that's a pain point. They're concerned about their cost. So if you're producing a plan that's minimizing their cost and exposure, and you ask that question about which doctor is most important to you, they're going to tell you, well, you know what? This is going to save me money. I can change my primary care just as long as you can keep my cardiologist, right? Or my neurologist. And don't be afraid to ask it, because they definitely will tell you what's important to them.
So do all agents have access to Sunfire or just advocate agents?
Most of the IMOs they're gonna depend on the IMO they're with, and if they're doing any kind of enrollments, it's either gonna be Sunfire or Connecture, because those are the only two platforms that are approved by CMS
Okay.
to process enrollments. So it's either Connecture or Sunfire, and they're both for
And
similar.
it could be called something else, but it's going to
Yeah.
be one of those platforms.
Yeah, they may call it Medicare Now or whatever, but if you look at the fine print, it's either going to be Sunfire or Connection that's running it.
Okay.
And actually, Connecture, Advocate uses Connecture
Yes.
for the Medicare supplement side.
Yes.
So if you want to run quotes for Medicare supplement, and you'll see that when you first go into
Right.
The Advocate site, you could click on Connecture or the Medicare supplement. It should take you over to Connecture for
Yeah.
those quotes. They're not done in Sunfire.
Yeah, Sunfire just don't pull them all. And actually Connecture, the reason I use Sunfire for many agents who are new, Sunfire is very user-friendly if you're just getting started in this. Connecture takes a little bit more navigation, so to speak. But transitioning over to Connecture and using it, once you understand Sunfire, it really is not a problem, because you're going to see more similarities than you do differences. So
Any questions on Sunfire?
I'll show them this real quick, Face, so that
Okay,
comparison. You can compare up to 3 plans at a time. Okay. And again, that's why I like using this tool. And it puts them side by side, so it makes it easy for you on a line by line basis to look at their plan to determine who's offering them best value.
right.
Okay.
And that's gonna help you when you're trying to narrow it down to one plan.
Right.
As Gus said, you're gonna be telling them the truth. I looked at, there are 42 plans available. I looked at them all, but
Yeah.
this is my, based on what you have said
Yeah.
is important to you. This is the plan that I would suggest for
Exactly.
you.
That's
And
exactly.
then you're gonna actually, would you scroll down and show them where to find the summary of benefits?
Well, yes, I will. The summary, but I'm looking here in Florida. Look at those max out of pocket. You guys got some pretty awesome plans there.
Yeah, but those are snips.
That's okay. I haven't saw anything with a $500 max out of pocket.
That's a snip.
Yeah, you scroll all the way down to the bottom of this, and you will have every document that you need to be compliant. There's your summary of benefits. You want to see it, just click on it. It's going to display it.
So
Right.
once you have chosen what the plan is that you're gonna offer to the individual, you have to go over the summary of
summary.
benefits as part of your enrollment process.
Right.
So you pull up the full summary of benefits.
Yep.
And you
this
can
would be
do
this.
all of that right there in Sunfire, and then go back to the agent portal. And as Gus said, if you are appointed to sell, that button that says not appointed to sell will actually say enroll.
Yeah.
And you click that button and you just follow through.
Right.
Then the only thing that you will be should have some concern about after you complete all of the information for the enrollment is, how will you get the signature? How will you capture the signature?
Right. You have 3 options on it. You can do it electronically, where you can send them an email. You can do it via text, or if they're in front of you, you can have them sign it right, type it on your computer. Now, when you're looking at this screen here, what we're looking at now is the benefit detail. But if you look over here, we put those prescription drugs in, right? So if you look at the drug costs, and all the drug costs across the thing is going to be pretty much the same, but this will tell you the tier of the various medications. See here, this one, not in formulary, right? Not in formulary, the Zoloft. So that's why you see that inflated cost over there when you first log on to this of the high price. Those drugs are not in the formulary.
So
And
those prices that we saw, that 8,000 something, that's annual, what it will cost them? Or
this
that's
is the
just,
drug benefit. Oh, this right
Right.
here is the annual drug cost based on what we put in. Yes, that's
Okay.
correct. Now, if we remove these here that's not in the formulary, you'll see that's going to go way down. But these drugs are not in formulary, so it's calculating the full cost of what those drugs will cost them. But the value to you as an agent is that you can counsel that client and say, hey, Mr. Wright, this drug here is not in the formulary, but I know that you can get that drug through GoodRx. It's like $9 and something, right? They just don't have it in the drug plan formulary for whatever reason they made that change. So that kind of thing. Or in this one case, I think they offer a generic brand of that particular drug. So it just gives you the tools to help educate your client on, because they're believing that, hey, I don't want to roll in this plan because it's not going to cover my medication. Well, guess what? None of those plans are going to cover your medication. None of those 42 plans. So that's telling you is not in the formulary. The doctor going to have to write something else, or you're going to have to make a change. And that's not, don't be afraid to let people know that, because this is where you as an agent and the professional letting them know this because they could be under the impression, well, I'm not gonna enroll in the plan because it's not gonna cover my medication. No, it's not the case. None of them are gonna cover it. Here's the reason, right? Okay. So that's kind of the gist of it, but it's a very usable, user-friendly tool. And you can go in there and create on yourself just scenarios and just get comfortable using it. There's no harm that you can do on
Just
it.
do not submit.
Yeah. If you got an enroll button, just don't, you can go all the way through it, don't get to the end and submit it. So
Do not submit.
Does it
So-
have an area where it shows the video? No?
the video for is this training.
No, not for the training. You know, when you go to the clients and you can show some of the carriers where you can click, like when I go to Humana, the
No.
video. No,
Oh,
okay.
That's on the Humana site, and if you're gonna be using the videos from any of those carriers, you need to download them on your laptop or
Yeah.
your tablet and have it available to play when you get there.
right.
Okay.
So you're
and
not
that will-
fumbling around looking for it. You need to
Right.
have it downloaded in a folder where you can easily access it.
Correct. Yes. Because when you're meeting with a client, you know, and it's kind of different schools of thought. I'm sure. Some people, I got somebody, they say, hey, if I'm in the house, I'm gonna get an application regardless of what happened. Well, that's okay. You just want to make sure you're making the right decision there, so you don't end up getting dinged for making the wrong one. But taking advantage of that 48 hours can be real beneficial to you with that rule there. Because that gives you 2 days to look at things like this. And if you have that conversation on the front end and get as much of this information as you can, when you do have that appointment, you're very comfortable at, I'm making the right recommendation that I'm going to enroll this client in because I've had time to check this out, right? So just some ideas, food for thought there, because you can use that. A lot of people would complain, hey, I got to wait 48 hours, but that 48 hours can be a good thing in some cases.
Mhm. So this kind of work like what you guys call sort of like the CRM type of thing?
Yeah,
Similar?
Well, it is a CRM, yes. So you could,
Okay.
all of your, but only what you've written through Sunfire is going to be here.
in there, yes. Yes.
Okay, so do you use that and still use it separate on your own? Or does
I
it-
do personally because customers have other benefits that are not written through Sunfire.
Right. Yeah.
And then, you may have a customer who has a dental only plan that
Yes.
wasn't written through Sunfire. You may have a customer that has a life insurance policy that
Correct.
wasn't written through Sunfire. You may have a customer that has a cancer policy. You may have a customer that has juvenile life policies on their children. That's not going to be through Sunfire.
Just wondering, because I heard some of them can be pretty expensive. I don't know.
Yes, they can be, but there are some that are not. I mean,
Yes.
the less annoying CRM is only $15 or $19 a month.
Right.
And it does all of those things for anyone who's just starting. There's no limit on the number that you can enter, and you can set it up with as many categories as you want.
Right.
And it has all the policy information, has the tasks, so it notifies you of their birthday, any tasks that you have coming up. It
Right.
does everything that any other CRM does when you are first starting. The only thing it doesn't do is calculate commissions.
Sounds nice. Less annoying?
Less annoying CRM. I think I put that link in an
Okay.
email at
Okay.
some point, but if you all need it again, I'll send it.
Okay, I'll look for it.
And now the biggest benefit of using Sunfire connected to Advocate is, again, for your Medicare clients like this, is really valuable in helping you to filter the plans and make the right decision without having to look at several different carrier websites to try to see what plan benefits are offered.
I just thought of something too. At one point, CMS required that if you were going to show a comparison of Medicare benefits to someone, it had to come from Medicare.gov.
Correct.
So I think that has changed over the years. However, that's another reason for us to remember that if it didn't come from Medicare.gov, we probably should not be displaying our screen when
Yeah.
we're making these comparisons for ourselves. So it's okay to use the time to go through all of that yourself, look at the 42 plans and zero out the ones that are not necessary, or click in the ones that are important to that particular customer, make your notes, and then make a decision on which one you're comfortable
Right.
in presenting. And
Right.
also go to the carrier site and double check the doctors and the prescriptions,
Yes.
because you might get a different that the carrier site is supposed to be updated instantaneously. So while we're waiting for something to come over to Sunfire, the carrier site may be updated. So just
Right.
make that kind of second thing. It just gives you a little more time. So we want to rush, and this is why it's important that we learn to do things right, and we can do them. So when AEP comes, we have everything in a process. So we can go from appointment to appointment to appointment to appointment.
Yes.
Make sense? Okay.
Yeah. And by
Any-
looking at the plans right here too, it just helps you become educated as an agent with what plans are in the marketplace. And now you got that stuff in your head and you just kind of know where to go with a customer when you're talking to them. Yeah.
Any other questions?
All right.
Okay, you want to,
Let me give your screen back.
okay.
Okay. Well, where is it? Stop sharing. There we go. There we go.
Okay.
Awesome.
All right. So we had some new people join us as well. So if you have some questions, we'll answer them quickly for you. If not, thank you all.
And Faye, can you just resend that CRM? I don't know that I got it, or if I did get it, maybe I overlooked it.
Okay, I will. And the link that I send you, I think, gives you 2 months free. Where
Okay.
if you just go to the website, you get